Um, Hello, everyone. We're back with yet another informative and interactive live workshop at Parenthood. I'm Namrata, and I'm looking forward to hosting this workshop with our expert pediatrician, Dr. Janardhan Reddy. Dr. Reddy, welcome.
Thank you, Namrata. This is Dr. Janardhan Reddy. I'm a pediatrician. So at present, I'm working in government health setup as well as dealing patients in a corporate health setup. So that I want to give a comprehensive outlook on the current issue, which is the poor air quality index. So as I see a comprehensive set of patients who come from poor background as well as uh, uh, you know, a, healthy and wealthy set of patients. So now my aim is to give you a complete information regarding air quality index and the impact that it has on the children.
Right. Right. So, viewers, just like Dr. Reddy said, our focus for today's session is the impact of bad AQI on children and how we can protect them from it. So, just to set some context, in 2023, India ranked 8th in the list of countries with the worst air quality index. But this year, we've made it to the top four. Despite efforts, our country is still struggling to breathe clean. So, this continuous exposure to polluted air drastically impacts a grown up's lungs, and it impacts toddlers and children even worse. So, how do we as parents, as guardians, help our children breathe clean air? So, Dr. Reddy here today will cover a variety of topics around bad AQI. How do we protect our children from bad AQI? What can we do better? And what are some necessary measures that we can take as parents to protect them? So, Dr. Reddy, if you can please explain what the impact of bad AQI has been for children until now, that will be really helpful to start this session.
So actually, if we observe, so there is ongoing discussion regarding the air quality index. If you see a newspaper, daily you will have a news article regarding air quality index, how the air quality index has been impacting the health of people. And at this point of time, even the adult people are suffering a lot, and you can imagine the impact it has on the lungs of a kid. So especially school going children are falling victim to these poor air quality. Suppose you can take the environment like national capital territory, where the air quality index is becoming a issue of deep concern. So so recently we have seen a news where the air quality index has dropped to 400 and above. So 400 and above means even a healthy lung will be very much impacted. So in such situations, we have to be very careful while we send our children outdoors. Is it that much necessary to expose the tender lungs to such a poor air quality? This is the thing which we have to, learn about and think about. So first thing I would like to say is, if we have to protect our children from the poor air quality, we have to take certain basic necessary measures where, so if there is, we have to decrease the interaction of the child to the outdoor environment. So then only, first thing is we can, decrease the exposure of poor air to the children. And then if at all necessary, then only we have to send the children outdoors, and at that time make your child wear a mask. And what mask we have to wear and all, we will discuss in the discussion as it progresses. Yes, Namrata, can we progress our discussion?
Yes, of course, of course. So before we proceed, I would like to point out to parents who've just joined us that we will be taking live questions in this workshop. So
Yes.
whatever questions you have, please ask them in our comments, and we will get them. We will get as many of them answered. All right. So, Doctor, I will just proceed with our questions that we have today. So, first of all, what are
Yes.
some necessary measures that parents can take to protect their children?
Yeah, as I already said, first thing is restrict the outdoor activity of the child. So suppose a day where the air quality index is very poor, that means the AQI has dropped to 200, 300, 400. These are the worst indicators. At that time, limit the activity of the child in the outdoors. So reduce the time the child spends in the playground or in the school. So this thing you have to do, and then if necessary, if the child has to go out, then make him wear a mask. And what mask he has to wear? Preferably N95 or the similar things which can filter out maximum air pollutants. And then third thing you can do is within the home you can have some air purifiers or air filters which can filter out maximum air pollutants. And then as a long term measure, what you can do is you can plant, you can have green plants in the house if that is possible. So that makes about plants, they will enhance the oxygen concentration within our surroundings. So at this point of time, it is the responsibility of every person, every parent, to give as much pure air as possible to our children. So as part of these things, if you can follow, you know you can protect your child from the worst impacts of the poor air quality. Yes, Namrata, shall we move on to
Right.
the second question?
Yes, yes, of course. Right. So, doctor, you mentioned wearing N95 masks, right? Now, there are a
Yeah.
lot of different types of masks available in the market. Are we
Yes.
saying that it is only N95 that will protect children, or are there any other types of masks that we
Yeah,
can look
this is
at?
a good question. Yeah. See, there in the market there are many types of masks are available. Normal cloth mask is there, and also surgical mask will also be there. But so these surgical masks or the cloth mask which is available, in the market, they may not be that much effective to filter all the pollutants. So it is advisable that we wear N95 or the similar mask means which can filter maximum air pollutants. So those are like KN95 is another mask, and FFP2 mask is another similar kind of mask. Since N95 is the thing which we know during COVID times and all, so I'm mentioning the name. But there are similar masks which can filter out maximum air pollutants. So those are like KN95 is there, and FFP2 is there. So these are some other kind of masks which can be advised.
Right. Okay.
Yeah.
Okay. I think that's really helpful. Helps parents make good decision when they're buying a mask. Right.
Yes.
So, doctor, now I think I want to come on the topic of how does bad AQI impact pregnant women and the babies that they carry? Like, does it impact them in the long
Yes.
run?
Yes, definitely. See, these are the pregnant women and the babies and the fetus. So these are risk groups which are you know at the receiving end of the poor air quality. For example, pregnant woman. You take pregnant woman. So if the pregnant woman is getting exposed to the poor air quality, what are the problems she faces? So one thing is, already pregnancy is a condition of high high metabolism and whatever you say. So those people are at higher risk. So pregnants, especially if they are exposed to the poor air or polluted air, then their respiratory capacity or the lung capacity will decrease, and they are more prone to the respiratory infections. And what happens? This will impact the fetus as well. So this will lead to premature deliveries. Premature deliveries means baby usually gets delivered at 40 weeks or 10 months. So because of the poor air quality and the respiratory infections and the whatever impacts that pregnant woman lands in, that will get transferred to the fetus or the embryo. So then it will lead to premature delivery, and there will be low birth weight of the baby, and then the baby may also carry certain infections. See, the main thing of poor air quality is like PM 2.5 particulate matter will be there. So that will be getting transferred. In certain instances, there is an evidence that these pollutants may get transferred through placenta and impact the babies. So the tender lungs within the womb may get affected because of the poor air quality to which the pregnant woman got exposed to. So yes, this is certain that the impact of the poor air quality is much worse on pregnant women and the infant and the fetus that is in the womb. Yes, Namrata.
Right. Right, right, right. Okay, so now in case of infants, are there any symptoms that parents should watch out? Any symptoms that tells parents that okay, this bad AQI is impacting my baby really badly. So what are those?
Yes. So, for example, if you want to know that your baby has the symptoms or signs of the bad air quality index, you should watch for the respiratory function. Is the baby breathing normally or not? If the baby is breathing normally and the baby, is not getting suffocated or is becoming uncomfortable and all, so then that is a first sign. And then in the long run there will be impact on the cognitive abilities also. So if a child that has been grown for years in an environment where there is a poor air quality, that will also impact the intellectual capacity or the cognitive abilities of the child. And also overall you can assess, so in a year how many times the child is falling sick, how many times my child is getting fever, cough, cold. So for example, if a child is getting fever, cough, cold frequently, two times in a month, three times in 2 months, or six times or five, seven times within a 6 months duration, or multiple times like 10 times in a year. So that can be a sign where you can think that the air quality in that particular city or particular surrounding has been having a toll on your child. So you have to watch for the breathing breathing quality and the frequency of the infections that your child is landing on, and then the cognitive abilities and the overall immunity function that your child possessing. So these will give an idea about whether your child is getting your child is falling victim to the poor air quality or not. Namrata.
Right. Yes. Okay. Thank you, doctor, for answering that. Now, what should a parent do if a baby is showing signs of difficulty in breathing? Like, are
Yeah.
there any immediate measures they can take before they
Yes.
consult a pediatrician?
Yes. See, for example, if you have a doubt that your baby is actually having breathing difficulty. So breathing difficulty means, what is breathing difficulty? First thing, the rate of respiration, rate of breathing will be very high. So you can observe a normal child, you know the rate, for less than 1 year child, a rate of 30 is normal. So for a child more than 1 year or 1 to 5 years, the rate decreases. For an adult is, it will be like 18 to 20 is a normal. So you can see the rate of
Right.
respiration increases, and then there will be like retractions will be there. You can see the chest where chest indrawing. You can see the chest indrawing, and then in infants may less than 1 year babies, so you can observe cyanosis, the lips and the tips of the fingers, there will be cyanosis. Cyanosis means there will be bluish discoloration will be there. So, and then the child will be irritable, the child will be uncomfortable. In such a situations, you can say that the baby is suffering from breathing difficulty, and that may be or can be due to the poor air quality.
Right.
Namrata.
So, doctor, if they see such symptoms, like you said, discoloration, if they see such symptoms, what should be the immediate step?
So if the child is having, whatever I said, like, increased respiratory rate, chest in drying, or bluish discoloration, first thing you have to do is, if the child is outdoors or if the child is in the surroundings where the air is polluted, first make him shift to the area where it is well ventilated, or if you have to shift to the indoors, make sure that there is an air purifier or air filter or certain humidifier. So make that thing, and then if possible or immediately take the medical help. you know call to ambulance and shift to the hospital, or if you have any doctor nearby, make him a call and ask the intervention and shift as immediately as immediately as possible to a medical facility, Namrata.
Right. Right. Okay. Okay. So, okay, doctor, let's come to a sensitive age group. Children who have pre-existing respiratory conditions like asthma. What should parents of such children do during a time like this? Are
Yes.
just masks, purifiers enough, or should they take extra measures?
Yeah, actually, these are the high risk group because they are already having some pre-existing illness. So these asthmatics are allergic patients. They are, more prone or more vulnerable to the poor air quality. So they may land in, even worse conditions, or they may even require hospitalization. So for that, the parents should be very vigilant. They have to take care of the children with, if they are having, they are using medications, please use the medication properly. And then for the asthmatics and all, limit the outdoor activity as much as possible. And then if those people are having any symptoms like rapid breathing, cyanosis, and these asthmatics will be having wheezing, a patient with asthma, the parents should know when to consult a doctor, when to seek medical help, and they have to know the signs, the early signs, so that they can immediately consult the doctor or health facility. So they should have pre-medications at hand. So they have to pre-medicate the child and then take the child to the health facility so that they can, help the child as early as possible. Namrata.
Right, right, right. So, doctor, just like children with respiratory conditions, are there any other child groups that may be sensitive to bad AQI? Should, children with, if children have other conditions, should parents be aware? And which conditions are those?
Yeah, see, not just see, we still now have spoken about the respiratory conditions, like asthma, bronchitis, and all. Not just them. So there are certain at-risk conditions like cardiac conditions. The children can be there with cardiac conditions. So who may be having, already certain surgeries have taken place and they may be having implanted devices and all. So those are at risk. And then people with immunodeficiencies, the people with primary immunodeficiency or secondary immunodeficiency, these are a group of people where they are at risk. And then people with malignancies, can say the leukemias and all. So those are the category of people who are at risk. And then the people who have undergone certain major surgery and then in the recovery period, during the recovery period, so those are also vulnerable. And then the people are the children who are using, medication for any chronic medical illness. So those are also the people who have, you know uh, who are vulnerable. And then the people who are malnourished. Malnourishment means either it can be undernourishment or overnourishment. So either in are vulnerable for the, poor air quality and Namrata.
Right. Okay. So, doctor, coming to this hot topic called air purifiers, right? Around this time, we see a lot of chatter on air purifiers. A lot of people invest in air purifiers. I just wanted to understand from a medical lens, are air purifiers really good and are they necessary? Like, even if they help, to what extent do they really, really help?
Yeah, these air purifiers are, effective for indoor air pollution. So this you have to understand. So indoor air pollution, there have been studies where they have been proved effective, where they could filter almost 99% of the air pollutants. So for indoor air pollution, you can use the air purifiers or air filters. And for outdoor air pollution, so you cannot, use the air purifiers or filters, and there are no studies supporting that. But for indoor air pollution, yes, you can use air purifiers or air filters, and that has proved effective.
Right, right. Okay. So, we're actually receiving a fair number of questions from parents. So, doctor, I'd just like to, start with these questions. So the first question we have is from this parent called Nandini. She asks, are there any specific foods or supplements that can help boost my child's immunity against pollution related health issues?
Hi Nandini, good to hear from you. So yes, you have a very good question. So I think you are asking about the home remedies which we can do. Yes, there are certain home remedies which you can do at home. You have asked about the immunity boosters and all. So one thing you have to know about home remedies is there is no scientific evidence, but you can try this. You know, Usually, grandmothers and all they'll give turmeric in the hot warm milk, so that you know that is helpful. And also at your home you can have steam inhalation with eucalyptus oil and all that will be helpful. And you can have honey and ginger mixed, this you can give to the child. So but these home remedies are the immunity boosters which you can try at home, are very helpful only for children above 1 year only. These honey and ginger mix and all you better try for more than 1 year old only, not for the less than 1 year old. So these can be tried. These can be, there are there is no proved evidence as well as there is no harm also. Yes, you can try these things, Namrata.
Okay, thank you. Thank you, doctor. Okay, so we have another question. This is from a parent called Sanjana. She asks, I and my 4-year-old go out for walks in the evenings, but the air seems worse around that time. When is the best time for outdoor activities, if any, during high pollution days?
Hi Sanjana, this is a very good question. See, taking your child, to walk when the poor air quality is very poor is not advisable. So actually, Pollution Control Board is giving you the air quality index for all the major cities. So you can observe in the website wherever your city is there. You can just go through the website and see, and just observe over a period of 1 month or 2 months, and just check at which part of day the air quality is better. At that time you can go out. So the air quality is better means, see, 0 to 50 is good air quality, 50 to 100 is satisfactory, and above 100 do not take the child outdoors. Namrata.
Understood. Great. Doctor, I have another question from a parent named Jaspreet. I think this is a question that a lot of parents will find relatable. Her question is, my 3-year-old hates wearing masks, but I'm worried about him breathing in all the pollution. Are there any masks that are more comfortable for kids, or should I just avoid taking him out altogether?
Uh, yes, Jaspreet, this is very concerning question for every parent who has a toddler.
Yes.
So making a 3-year-old, 4-year-old child, or less than 5-year child wearing mask is a very difficult thing. I know that, and everyone knows that. So the best thing is, as you said, so avoid the outdoor activity as much as possible. And making them wear an N95 mask, maybe they may not like that. So, and some kids, they feel claustrophobic or something uncomfortable about the mask, they will not simply wear that. So it is better that take them to an area, or where greenery is there, a park is there. You can take them in the car if possible. I'm just saying the possibility. So you can drive them directly to the park, and then within the park, usually the air quality index expected to be better. So there you can take the child out for a walk for a few minutes, and then take them in the car or some other vehicle, and then take him home safely. See, as I said earlier, while answering Sanjana, the air quality index, if it is more than 100, please avoid taking the child outdoors. So it's better for them to walk in the surroundings when the air quality index is less than 100. So these things you can do, just breathe. Namrata.
Right, right. Okay, so another question, doctor, from a parent named Maria. Her child is 5-year-old. She says, my son often complains about a tight feeling in his chest after playing outside during the smoggy season. Could this be an early sign of a respiratory issue related to pollution?
Hi Maria, thanks for the question. And yeah, whatever you are saying for your 5-year-old child playing in smog, I mean the complaint of chest tightness can be a sign of respiratory difficulty. So just see, whether the child is feeling the same in the outdoors and the foggy season only, or the child is experiencing the same things in other circumstances. So whether the child is having the same thing when the child is active or even at rest. So these things you have to do, and then get evaluated with a pediatrician, get them auscultated in the chest. Maybe the child can be, wheezing possibility can be there in such children. So get them evaluated and see if the child is early wheezer or not. So if the thing is, so if the pediatrician finds that this is related to certain asthma kind of thing, so better start the treatment early. See that it is only, if it is only on the 1 or 2 occasions, then it's okay. But if it is recurring, if it is persistent, then it is advisable to approach your pediatrician. Namrata.
Right, right. Okay, so doctor, I think a lot of parents have raised their concern about, the pollution and how their children are now almost starting to struggle. One parent also asked about certain specific foods and supplements. So, doctor, we are expecting the AQI to go bad over the next few weeks, right? What are
Yes.
some ways in which parents can help build their child's immunity in general so that they are better prepared to, fight out whatever uh, issues they may have to face otherwise?
Yes. So this is a good question. So because whatever we have at our hand is to boost our immunity so that our immune system can fight any external infection that comes. So what is this immunity boosting? What we have to do to boost our immunity? See, the thing is, first we have to observe our intake. That means the food. So whatever food we are taking, make sure that that is nutritious and healthy and it is safe. So try to take the food, which is safe and healthy. So try to add fruits in your diet. Try to add food which is rich in antioxidants. Antioxidants and vitamin A, vitamin E, vitamin C. So if you can have a mix of food which is rich in these things, then it will help in boosting your immunity. See, leafy vegetables are rich in vitamin A, and nuts are rich in vitamin E. Citrus fruits are rich in vitamin C, and you can add, protein diet. You can add protein to the diet as per the age of the child. See, you can add boiled egg daily, one boiled egg to the diet of the child, that will give protein to the child. So by this way you are giving a diet which is rich in all the immunity ingredients. So these are, as I told, vitamin A, vitamin E, vitamin C, antioxidants, and then protein. So these are the things which have to be in correct proportions in our diet so that our immunity system functions at the fullest potential. So make sure that your diet is balanced with all these things, and then plan the diet accordingly so that you can add fruit in the diet in the evening, boiled egg in the afternoon, and then leafy vegetables should be there. So you can mix the, you can have seasonal fruit, and antioxidants. If the child is uh, little elder, like I mean, 12 years, 13 years child, you can give him green tea also, which is rich in antioxidants and all. So like this, you can have all the ingredients which will help to boost your immunity. So this thing will help your child get better immunity. Namrata.
Right. Yes. I think that's great. I think this is something that parents can incorporate at home. So it should be helpful. Coming to our next question, it's from a parent called Megha. She says, my kids aged 6 and 9 have been waking up with stuffy noses and itchy eyes. Could this be related to the air quality, and how can I manage these symptoms at home?
Hi Mega. So the thing you are saying about your 6 and 9 year kids at home. So it can it be due to air quality and all? We don't know because the child they are sleeping within the home and they are waking up with stuffy nose and all. So usually the air quality related symptoms may not be, you know, during the nights and indoors. So those are much related to the outdoor things. But you have to think that the indoor air quality is also an important thing here. So make sure that you have humidifier in your home or certain air purifier or air filter at your home, and see the reason for the stuffiness of the nose of the children. So you know, some children may be having repeated respiratory infections and all. So those children, they may, you know, they may pull up secretions in the oral and nasal cavity during the nights, and then that will lead to the stuffy nose. So for that you can have certain you know, decongestion, nasal decongestion. You can use nasal decongestant while, you know, before the child sleeps and all. So that will keep the airway clear, so they will have peaceful sleep and all. And this stuffy nose problem, so you know, uh, may get a solution. And if the solution is still persistent, you can contact your pediatrician, Namrata.
Okay. Okay. Great. Moving on to our next question, Doctor. Ravleen asks, our pediatrician mentioned that bad air quality can lead to ear infections in children. Is this true? And how can we prevent this, especially during peak pollution days?
Yes, air quality, as we discussed, that yeah, not just the respiratory infections can lead to ear infections as well, because the oral, nasal, and the ear, these are all connected. So there is a structure, anatomical structure called eustachian tube that connect nasal cavity to the, you know, ear cavity. So these are all the connected systems where the we inhale the air, the pollutants, and they will contaminate not just the nasal cavity, oral cavity, and due to the communication, they may affect the ears as well. Yes, that's true. And how to get protected from this thing? Yes, we have already discussed. Make sure that your child have all the necessary precautions that we already discussed, like you know, limit the outdoor activity, have the, you know, mask and all, how the indoor air pollution purified, you know, indoor air purified and all. And if there is still the, you see, nasal stuffiness will usually lead to eustachian tube block, and that will lead to ear aches and all, and then eventually that may lead to ear infections and all. So for that you have to act early, you know. So contact the pediatrician, what he says, let him examine, and you know, take the medications as advised if the solution is persisting, Amrita.
Right, right. Okay, doctor, we have another parent named Vikash. He says, my 3-year-old has asthma. How can I manage her condition with such bad air quality?
Hi Vikas. So this is concerning that the 3-year-old child is already having asthma and all. Yes, the air quality is another pressing thing on the tender child. So I can understand how a 3-year-old with such wheezing difficulties comes to the OPD, and thus, you know, their suffering is unimaginable. So, for them to live in a, you know, surrounding where the air quality is very poor, as a parent, you should be, you know, trained enough to understand the pre-symptoms, symptoms, and then what, you know, what steps you have to take when the child is having acute attack. Okay, first thing, as the child is already diagnosed with asthma, as you already said, so keep the prescription in hand, and then keep xerox of the prescription in the school bag of the child, so that if the child had any acute asthma attack while the child is in the school, so that prescription will help the school authorities to give the medication immediately. That thing you have to do. And then the second thing, keep the medication handy, and if possible, you should, maximum point of time you should accompany. There should be a guardian along with the child. So because of the poor, whenever the air quality is falling down, it's going on 200, 300, 400, climbing up like that. So please don't allow the child to go outdoors. Limit their activity. Let them stay indoors. Okay. And then in home, you have to have humidifiers, air purifiers, air filters and all. And then one more thing, as a child, you know uh, grows in age and weight, you need to have periodic evaluation and consultation with your treating pediatrician. They may require any change of the medication, any change of the dosage of the medication, that you have to do. And then, so with periodic consultations, timely consultations and all, you may help your child with effective treatment at home and at school and at outdoors. Namrata.
Right. Okay, doctor, we have another question. This is from a parent called Radhika. She says she is 7 months pregnant and is worried about how the air quality will impact her pregnancy. She is also asking for suggestions on what she should do.
Radhika, yeah, so 7 months pregnancy is, uh, this is a, very mature stage in the pregnancy. So at this stage, yes, the poor air quality is a factor of concern. So one thing you have to do is, at 7 months you are already, with, too much of anxiety, too much of, emotional burden and all, and you need emotional support as well as medical support as well as physical support. And at this point of time, yes, the poor air quality is another burden on you. So limit the activity, limit the outdoor activity. Whenever you want to seek medical consultation and all, try to reach the medical facility in a secure and safe surroundings. Yes, and if you are having any respiratory related problems like breathing difficulty and all, so seek immediate consultation, because there is no place at 7 months of pregnancy. There is no place for home remedies and all. So as soon as possible, better consult your gynecologist and all. And yes, there is, the impact of the poor air quality and the respiratory infection to a mother, a pregnant mother, will have the possibility that it will impact the fetus. So it will have an impact on the, growth of the baby, the birth of the baby, and it may also lead to premature deliveries and all. So this is a time period where you have to be very protective of yourself, so that you'll be protecting your baby. Yes, Namrata.
Right. So, doctor, see, we've been hearing from a lot of parents and expecting parents on their concern about how the AQI is affecting them. And there is this trend of a lot of people with means. They generally leave the city or the town for a certain period of time when the air quality is really bad, and then they come back once the air quality is settled. So, is that something you would recommend for people who have the means? Should they? Is it a better option to maybe you know remove themselves from that particular area and move to a place with a better air quality, or does that not help in the short run?
That is a good option, but it may not be feasible for every person. So because only certain category of people, a certain section of people
Yes.
may, they may be having that option. For example, software engineers who are working from home. So they can
Hmm.
do that actually. So they can move to their villages or tier 2 cities and all where the air quality is better. So and then again move to the metro cities when the air quality is better there. So we can call this that air pollution migration or whatever terminology we can come across. So is
Right.
that we can do. And yeah, so see if we can avoid the peak poor air quality in the Delhi, then that's obviously better. If you have an option, better go for that.
Right. But doctor, if you're exposed to bad quality for, let's say, more than 10 days, and then, you travel to a place with decent AQI for maybe 3 days, does that really help?
Uh, yeah, actually, see, you whatever you have mentioned the period like 10 days and 3 days here. So rather than staying 13 days there, 10 days there, 3 days here is actually a better thing. So it is a
Right.
much better thing. But what happens here is while you are staying for 10 days in a zone where the air quality is poor, make sure that you have the precautions whatever we have been discussing, so that will definitely help you. And if possible, you can shuffle between that and this place. Yeah, that we can do.
Right. Right. Okay. So, I think we'll just take one more question before we end our life. So, there's this parent called Rashi where she says, we've been noticing more cases of allergic reactions in our kids, especially skin rashes and watery eyes after Diwali. Could this be linked to air pollution, and how should we treat or prevent these symptoms?
Yes, actually, see, after the festive season and Diwali and all, so the air quality even slumps, even goes down. And yes, that can be a reason of the allergic rash. And this allergic rash will lead to the rash, skin eruptions, and watering of eyes and all. So yes, whatever you are saying, these things can be due to the poor air quality and all. So what we can do at such situation? So if we want to talk about the Diwali and all, so for the 3 or 4 days during and after Diwali, better avoid the outdoor activity as much as possible. And then if the child is having watering of eyes and the skin eruptions and all, make sure you wash the eyes of the child with pure water for initial treatment. And then if you have any emollient or skin soothener and all, you apply the skin soothener and all. If the child is feeling better and the symptoms are relieving, that's okay. But if the symptoms are worsening and all, so make sure that you consult a pediatrician or skin specialist in time. So that will help the child from that situation.
Great. All right, doctor, I think now we are nearing the close of this session. Before we close this session, would you like to, give a little note to parents as to, what they can do? A lot of parents are really anxious about how their children will get affected by it. So if we could just, round up this whole conversation and, give them with some tips, that will be really helpful.
Yes, definitely. See, this air quality, as we already discussed, is a thing which we can address effectively if we are aware about the situation. So, first thing as a parent, what you have to do is observe the air quality index data published by the government. It will be on the government websites and all. The Central Pollution Control Board publishes it daily, and then in the cities it will be displayed at important centers and all. So there you can just observe it and observe the trend and see that whether it is safe to take your child outside or not. So make a decision based on that. First thing that you can do. Second thing you can do is, if the situation is such that you have to take the child out, wear a mask. And we have discussed about the mask, better go for N95 mask. And then the third thing you can do is make your home safe from air pollution. How you can do that? Make sure you have humidifiers or air purifiers, air filters at your home. And then fourth thing you can do, not just as a parent but as a citizen, make sure you plant a tree. You know, you have plantations or greenery at your home, so that will definitely maximize the oxygen concentration in your surroundings. And then as a citizen also, so, at overall level, at the policy level, at you know you can reduce outdoor pollution by yourself, going for responsible consumption practices, like responsible practices where you can go for public transport, carpooling services and all. So participate in plantation drives and all. So these are the things which can help improve the air quality in our surroundings, so that it will protect our health and our children's health.
Right. All right. Thank you so much, Dr. Reddy, for sharing such valuable insights with us. I think, parents have really benefited from this particular workshop. So I just want to close this session by addressing parents. Please remember to stay informed about your local air quality levels, take preventive measures when needed, and don't hesitate to reach out to your doctor for help. Thank you.
Thank you.